The United States government made a critical decision to allow HIV treatment programs to continue in 55 countries, including Nigeria, through an emergency waiver for at least 90 days. Now, this move was driven by global pressure to ensure that millions of people living with HIV can continue receiving life-saving medications, offering some relief after the US had paused funding for these programs just days earlier. However, this waiver is temporary, and many vital services remain on hold, leaving the future of this crucial treatment uncertain. Now, before the waiver was granted, President Donald Trump has ordered a stop to foreign aid, including funding for the President's Emergency Plan for AIDS Relief, PEPFAR. Now, this freeze caused immediate and widespread disruption, particularly in low-income countries where PEPFAR has been essential in treating over 20 million people living with HIV, with 566,000 children included. Clinics were forced to cancel appointments, and many patients found themselves without access to the medication they depend on. The potential for a complete stop to the funding is deeply concerning. Health organizations such as the World Health Organization and UNAIDS have warned that this freeze could undo years of progress in the fight against HIV/AIDS. Without continued access to these programs, more people could become seriously ill or die from HIV, and the number of new infections could rise, making it harder to control the spread of the virus. For Nigeria, one of the countries with the highest HIV burden in the world, the consequences are particularly dire. In 2023, about 1.8 million Nigerians were living with HIV, many of whom rely on PEPFAR. PEPFAR funded programs for access to their vital medication, but these treatments are not only crucial for maintaining health, but also play a key role in preventing the transmission of HIV to others. Without continued funding, Nigeria's healthcare system could buckle under the strain, leaving millions vulnerable not just to HIV, but also to other infectious diseases. If the funding freeze continues, or if future support remains uncertain, it will be a major setback in effort to end the HIV epidemic by 2030. While the temporary waiver provides short-term relief, it doesn't guarantee long-term stability. Without steady funding, countries like Nigeria, where PEPFAR covers 90% of the treatment burden, could see an increase in HIV-related deaths and new infections. This would not only jeopardize Nigeria's health goals, but also derail global effort to combat the epidemic. The situation is fragile, and health leaders around the world are calling for clear, sustained support to protect vulnerable populations and ensure that progress against HIV is not lost. Do not forget to follow us on all our social media platforms on Fact News Hausa and Fact News Africa.